Assalamu alaikum wa rahmatullahi wa barakatuhu. I hope everybody is in a good state of Iman and health. Welcome to our first session under SPIRE-CHILD. This session was initiated upon request from a dear student who faced a case of child sexual abuse during her professional work in one of the hospitals, one of the teaching hospitals. And I had brought this case up on several forums in Pakistan. This was a case of child sexual abuse. This was a 4-year-old girl who presented to one of the hospitals, and the family, the child obviously had no idea what had happened to her. There were clear-cut signs of overt and very aggressive abuse in that child. Unfortunately, the family and the medical staff present at the time did not report, did not maybe probably did not have an idea of what to do with this child, and this led to literature search. This led to several interactions, several interviews on my part with professionals who work with children, who even work with child protective services in Pakistan, with NGOs, and the most noteworthy among them is one called Sahil, which is an internationally acclaimed NGO, and whose papers and facts and figures and statistics are quoted by national as well as international media, including Al Jazeera, UNICEF, WHO. Uh, this is the introductory session only. This is going to be a series of interactions. And right now, if I tell you honestly, it is myself and that student who reported it to me who are attending this Zoom session. I see one more participant, but I purposefully I selected a time over a weekend, a time that is convenient to most people, and yet the attendance that we have here is a mere 3 people. And I am not lamenting it. I mean, I'm not going to abandon the project because of a Zoom attendance. But the reason, since we are going to go into several issues and several reasons that have contributed to a lack of safety net for our children in Pakistan, and I would say for the children the world over, is the leading factor is a lack of interest. And I say this with a very heavy heart, because as long as it is not happening to me or to my child, maybe it is not happening. That is a common perception. That is a common understanding that all of us have, and that is a very big misconception, because an injustice somewhere is an injustice everywhere. So before I even begin, before I start the project, this is an orientation session that I am offering. It is recorded. It is free to attend, and this is going to be uploaded on YouTube as well. I will go over a brief PowerPoint presentation with some details that everybody can find very easily if they type child sexual abuse in Pakistan. And that after that presentation, we can have a small brainstorming session. And my number and email will be available with Dr. Fatma, all thanks to her. It is upon her insistence that this session is happening. So let me just share my screen with you. It's a brief presentation. I am a very strong believer in not putting people to sleep with PowerPoint. But this is where we are going to begin, inshallah. All right. So, briefly, I am Afshan Khattak. I'm a pediatrician, further trained as a neonatologist, and I have worked in pediatrics in Pakistan for the last, I don't know, maybe 20 years. I started in 2002. after my training, and I have worked in almost all the teaching hospitals. I've worked in the private sector. I have worked in pediatrics in Shaukat Khanam. So I have a well rounded experience of pediatrics in Pakistan. When the Kasur tragedy happened in Punjab, I was in Lahore. And I had an experience, or a first hand experience, of what devastating and what an earth shattering tragedy that was, and how it was handled, unfortunately. So let's move forward. The objectives for today's presentation are very, very limited. For the participants to gain a superficial overview of the scope of child sexual abuse in Pakistan. This is not a presentation about child labor. This is not a presentation about forced labor, about child smuggling, although all of them are interconnected issues, but this is a discussion about child sexual abuse. Describe the medical history taking and physical exam routine of child sexual abuse, and again, that is going to be in very brief detail. Correlate the occurrence of child sexual abuse with grave consequences in adult age. And then, especially to commit to participate in SPIRE-CHILD child sexual abuse campaign. So, these are briefly my objectives. The World Health Organization has defined child abuse very, very clearly, and we are going to stick to that definition for all practical purposes. Child abuse has been recognized as a major medical and social problem worldwide. It does not respect any geographic boundaries, any religious boundaries, social, racial, and religious groups, irrespective. WHO defines child abuse and maltreatment as all forms of physical or emotional ill treatment, sexual abuse, neglect, or negligent treatment resulting in actual or a potential harm to the child's health, survival, development, or dignity in the context of a relationship, responsibility, trust, or power. Now, this is a very well rounded definition, and we are going to go into its detail in subsequent sessions that will follow this one. Now, the most shocking revelation for me is what Wikipedia says about child sexual abuse in Pakistan. Here are facts and figures, and I researched them. I went over these facts and figures in rest of maybe newspapers, journals, and they did check out. They are well referenced. Pakistan ranks third in online child abuse, which is child pornography. That is provision of material as well as engaging of viewers in child pornography. Child sexual abuse is often neglected in Pakistan, which is true. The estimated child abuse in Pakistan is more than 12 per day. This is data from Sahil, which is an NGO, and it is not accurate, but this data is quoted online in Wikipedia, in which out of the total reported cases, 2,325 were girls and 1,928 were boys. These are all the references and they are all clickable links. I'm going to send this presentation to the groups where I had advertised, where I had shared about this session. And those who are interested can research the issue themselves. This is one systematic review by Adnan Ali Haider, who was Dean of Aga Khan University, who's ex-dean actually. He's I don't know, he changed. He's not there anymore, but Adnan Ali Haider is a public health expert, very well known in Pakistan, and he has published a systematic review of literature about child sexual abuse in Pakistan. Now, this is a report by Sahil, that is an NGO dealing with child sexual abuse in Pakistan. A total of this many children, like I mentioned, and some were girls and some were boys. About 164 cases of sexual abuse, 984 abductions, 201 missing children, and 14 child marriage cases were reported in the, this is 2022, were reported to Sahil. Cruel Numbers is a report by Sahil, which is quoted, which is widely quoted everywhere. So this is something that those who are interested in following with the campaign can refer to and can check out online. Now, I think if there is one slide that is very important in this presentation, it is this slide. The what is the algorithm? When we are planning, for me to tell you this is what it looks like, this is what it sounds like, children are bleeding, children are crying, there is so much unfairness, there is no child protection in our country, would be just beating a line that is already there. I mean, it would not mean anything, it would not benefit anyone. What is the actual algorithm of child sexual abuse is, you know, what do we need to follow? Where does child sexual abuse happen? Home, school, roads, offices, after school places, back streets. It happens everywhere. Disclosure to the primary caregiver. Now, once it happens, who will the child tell? There's a primary caregiver, maybe a parent, maybe a sibling, a teacher, a friend, maybe a sibling or a relative. Reporting by the primary informant. This is where we are lacking. Reporting by the primary informant about the occurrence of child abuse is something that is seldom done. And people even don't know that there are resources that they can use, and even if they know, they are reluctant to use those resources. Now, who is the first responder? Once a child abuse case or a child sexual abuse incident is reported, the first responders are either the police, the school security, law enforcement, and finally the child protection. Then there is the issue of medical documentation. Who does the history, the physical exam, and who gathers the evidence? First incident report or the FIR is the responsibility of the local police authorities. And then there is the implementation of the FIR, which does not exist in our country. Arrest, maybe cessation or termination of parental rights, court hearings, and sentencing. Now, sadly enough, we have no awareness, or even if we have awareness, we are in a state of denial. We do not have a system for the primary caregivers to to be aware that something, what if a case of child sexual abuse is reported to them, where will they go? Then the legal and the physical safety net does not exist. Most people will say that hum adalat ke chakkar is something, or thane ke chakkar is something that is the worst nightmare of people. Also, we have no training. And if all of this is met, if all of this is completed, we don't have transparency in the system. We don't. And I'm not saying this with any bitterness or negativity. I'm saying this for us to realize that if we want to help work against this menace, help work on, and fight against this tragedy, these are the ground realities that we must have in our minds, that we must know that they exist. Now, this is a report from Germany. So, I mean, I'm quoting it here because I don't have any such report from Pakistan. But just to give you an idea, that physicians who deal with children often have suboptimal knowledge of child sexual abuse, including the characteristics of victims and perpetrators, the medical diagnosis and therapy of sexual abuse, and rehab of the victims. So, we as doctors are lacking in all these areas. These I have taken directly from an Australian article, and it is the link is given here. These are all clickable links, so you can click on these links and go to these references. The what made you think that your child has been abused? Instead of asking, was your child abused? Do did you see it happening? Why are you saying that your child? What made you think? If a parent is reporting, then how did it start? When was the last time your child was with the person you believe may have abused them. Then, does your child have any symptoms? And then you ask, are there any problems with urination or defecation? Have you noticed any changes in their behavior? All of these are open ended questions, and I am going to adapt them into Urdu and Pashto, inshallah, and present them in subsequent sessions for those who are interested in learning about this issue further and to work with SPIRE-CHILD in practical and implementable steps that we can take as healthcare professionals against this issue. Now, this is asking the child. hmm, Instead of asking, were your clothes off? We can ask, where were your clothes when this happened? And a child will tell you better. Does he, now, if we ask about, did he or did she touch your private parts? We can say, tell me about everyone who has touched your private parts. Then, has anyone ever touched you in a way that you didn't like? Instead, you can ask, how do you call where you pee? And where does poop come out? This is for little children who cannot tell you where were they touched. So, to adapt the interview according to the child's developmental age or stage is very important. Then aims of medical examination. And I will go in detail about an algorithm for medical examination of a child suspected of abuse. And all I can promise at this stage is I can work with individual hospitals and individual professionals because beyond hospitals, we don't have a system in Pakistan. We do not. Adams classification, and I will not go into the detail of this, I'm only introducing it here. Adams classification is used to make sure that a sign that we are noticing around a child's sexual organs or genitalia is related to child sexual abuse because there are many normal physiologic variations that can be misinterpreted as child sexual abuse, and then there are many signs of child sexual abuse that can be misinterpreted as physiological findings. So Adams is a system of differentiating or confirming if a finding that we are seeing is actually child sexual abuse. Now, this is for the gynecologist colleagues here because in Pakistan, the first, the real crux and the real burden of sexual abuse is faced by our gynecologists who may or may not involve pediatricians. The gynecologic investigations include a head to toe physical examination, assessment of sexual development, identification of any injury with special reference to colposcopic appearance of the hymenal membrane and surrounding structures. Signs of abuse, diagnosis of a possible pregnancy by a urine test or ultrasound, and collection of forensic evidence. I don't know how much that applies to Pakistan. Like I told you, I could not find a lot of material from Pakistan. Evaluation for sexually transmitted infections is paramount. Appropriate medical or surgical treatment needs to be provided, which is provided in our country as far as the few cases that I have encountered. The physical examination in cases of suspected sexual abuse consists of inspection of the anogenital region. The child should be suitably positioned, supine, knee chest position, and lateral DQ. These three positions have been referenced repeatedly in literature. A combination of the three standard techniques, labial separation, labial traction, and knee chest position, increases the yield of positive findings and is also required by the current Adams classification. Now, I'm nearing the end of this PowerPoint presentation. Why is it so important? I mean, why should we be able to ascertain that child sexual abuse has happened? It has a potential for long term medical and mental health consequences. All of these are referenced. There is also significant economic and societal implications. Women with a history of childhood sexual abuse have a higher primary care demand and outpatient costs. Child sexual abuse is associated with risk of poor physical and mental health in adulthood. And again, secondary mental health problems with manifestations such as suicide, depression, post traumatic stress disorder, eating disorder, and multiple personality disorders, um, and child sexual abuse accommodation syndrome. All of these, I don't need to even go into the details of this. I'm sure everybody who's listening will agree that it is a lifelong stigma and a lifelong tragedy if such an incident happens in childhood. Psychophysiological consequences are premenstrual syndrome, unexplained GI symptoms, chronic pelvic pain, and problems of unwanted pregnancy, and then problems with a much wanted pregnancy. Child abuse come to our attention almost exclusively when a personal tragedy happens. So basically, where I started, like I said, that if it's not happening to me, it's not happening, is something that we face a lot in cases of in such tragic incidents of childhood sexual abuse. These are the references for the consequences that I mentioned for you, and all of them are clickable. So you are welcome to read and learn more about the consequences. Child abuse is this is again from the article from Adnan Ali Haider, is a complex and challenging subject. And in Pakistan, these challenges are exacerbated by limitation of resources in the form of availability of staff and time. This is compounded by a number of social and legal constraints, as well as lack of implementation of child protection laws. Now, for your knowledge, we have child protection laws existing in Sindh, Punjab, and KP. I'm sure there is a national child protection law as well. There are even child protection bureaus which work practically independent of the rest of the law enforcement system. So that is almost, or this is an in-depth study, a qualitative study done in Pakistan. Uh, and again, you are welcome to go over the references yourself. Like I said, that this is just a priming session because Spire is going to start a child sexual abuse, anti-child sexual abuse campaign. And all we can do at this level is to involve as many stakeholders, as many interested parties um, as we possibly can. This is the end of my presentation. I will stop the share now. And if there are any questions we have or any comments, you are most welcome. I will be noting them down, and this session will get uploaded on YouTube on my channel, and further sessions that will follow most likely, unless there is a panel discussion or there's something that the participants do not want to be identified, the sessions will get uploaded on my channel. Thank you very much for your time and attention. And if there are any comments, I'm right here. You can write, you can speak. Go ahead. Most welcome, Fatma. Is Dr. Mahjabeen here? I can stop the recording if.
Yes, I'm here. Yes, I'm here, Jeet. It's lovely to meet you and to see you, if not in person, but at least on the screen. And Fatima is a dear postgraduate resident, and she invited me. And this is a topic which, what can I say? I've always felt that we should all not just raise our voice, but do everything we can, possibly, to stop and to report all kinds of abuse.
Thank you very much, and I will count on your support with
Yes,
the
of course. I
upcoming.
told Fatma
Yeah.
that although my experience in this is not that I don't think it can match your experience, but I've had to deal with a few cases of abuse. I remember when I was a registrar in my evening round, a case of abuse was a patient was brought. So the reason I remember that I did report her from whatever I could remember from my fourth year forensics, whatever I could. But then I had to actually go to court to testify. Some years later, then the court sent an order for me to appear. At first, I couldn't understand why would the court want me to come. So then I had to go to Nushera and I had actually had to testify. So that was an experience.
Mm-hmm.
And usually these medical legal, then they go to the forensic department in our college, in Khyber Medical College.
Yeah.
But I guess it was evening and the college was closed. So the next option was the ops gynae unit on call.
Mm-hmm.
So yes, and in our OPDs, I have now started noticing with my experience that many mothers bring their children, their little girls, with discharge and vague complaints, hypogastric pain, and
Mm-hmm.
it's a scared child. And I've always wondered whether abuse lies behind these
Obvious.
symptoms. And
Obvious.
on my part, I've always tried to probe, ask the child, talk to her. One doesn't even know if the lady is actually her mother. It can be anyone
Mm-hmm.
saying, I'm the mother.
Yeah.
And another thing I've noticed that little girls, when the mother tells them
वो
to
हमारी
expose their
फोन
private
पर
parts and
हो रही है ना
show, so I don't
ऐसे
think
हो
that
रहा है ये जब
a
मैं
little
किसी
is
में
okay
शिफ्ट
to
नहीं
do
मेरे
that.
Mm-hmm.
ये
This
किसी
is my experience. I don't know. I guess this is just the tip of the iceberg.
Well, thank you so much. Thank you, Mahjubina. And I think that it will be very, very fruitful in a unit with a with a chair as receptive as you are, that we can begin with these sessions for your trainees and those who are interested, because I am trying to adapt. There's an international document which is adapted by Pakistan Pediatric Association that
Okay.
really does not apply to our situation. The problem with us
Right.
is that we do not have families. The prime concern, where the ripple effect will begin, is the family actually. It's not
Right.
the Child Protective Bureau, it's not the lawyers, it's not the courts, it's not the police. It's going to begin with the family. Until and
Exactly.
unless families are made aware that they can report and that they need to report to prevent further future tragedies, and that if
Right.
and the child has somewhere as a safety net to prevent
Exactly.
the tragedies that they are going to face in future if this is not dealt with. So
Right.
that my plan is to prepare, first of all, a curriculum for healthcare professionals and get it
Right.
translated in Urdu and Pashto. And then,
Okay.
have proper templates where they fill the details when they're talking to the child, where they're observing the child, where they're talking to the parents, to prepare a
Okay.
comprehensive report. And at least at our level, because unfortunately we are part of the system. So
Yes.
until and unless
I'm sorry, I'm interrupting you, but are you based in Peshawar?
I was based in Peshawar. At present, I'm in
O-
States. But my
Okay.
academic consultancy that Fatma
Okay.
belongs to as well, is
Right.
in Peshawar and Islamabad. So we work
Okay.
out of Peshawar, Islamabad, and a lot of humanitarian work out of Karachi. So access will not be a problem, inshallah. And
Right.
personally, I mean, end of the year, I will be coming to Pakistan, and I would like
Okay.
to meet everybody who gets involved in this project because we're going
We
to,
will very much like to invite you, and we will
thank you very much,
organize a seminar.
inshallah.
I think, you cannot even call it a topic or an issue. It is something so sensitive.
It is.
I think it is a life-changing event for the victim and the family.
It's a
So we will,
life-shattering event. Yeah,
ji.
a life
So
ends practically.
we will, inshallah,
Yeah.
arrange. awareness session on this. And whenever you plan to come, let us know beforehand so we can arrange
Inshallah.
something.
Oh yeah, I mean, my
Right.
ambassador is with you. I have full trust in her. It's
Okay.
all credit goes to her. Believe me, I think she's the youngest participant here, and all
Right.
credit goes to her because she took the initiative. And I still, I mean, if I, with her permission, she said, "Madam, I cannot sleep at night. I am unable to sleep at night since I saw, whatever she did, whatever she experienced with her patients. She saw a patient,
Okay.
and really, I wish we had more sensitive and I don't know, true to their word professionals,
Right.
especially around this issue."
Exactly.
थैंक यू मैम मैम आप सबसे बहुत अच्छा लगा मैम मुझे तो बिल्कुल रोना आ रहा है क्योंकि मतलब इतनी अच्छी डिस्कशन हो गई है सबके साथ और स्पेशली थैंक यू डॉक्टर माचबीन कि आपने ज्वाइन किया और मैडम
My
स्पेशल
pleasure,
थैंक्स टू
Fatma.
डॉक्टर अफशा कि
My
आपने
pleasure.
सेशन किया और इंशाल्लाह आइंदा भी ऐसा करेंगे और
Inshallah.
जितना हमसे हो सके इस इशू पे बात करेंगे और अपना इनपुट देंगे हर लेवल पे इंशाल्लाह थैंक यू सो
Inshallah,
मच
inshallah.
Thank
I,
you.
yeah,
Thank
most
you.
welcome. I will be sharing the timeline with you, Fatma, and then
ठीक है मैम
I think it's just total of 4 sessions, maybe in 2 or 3 months, and then after that we will meet and we will have,
हाँ,
we'll
इंशाल्लाह
go over the curriculum, and inshallah, I hope many people benefit from this.
Thank you so